Well, welcome everyone, and thank you so much for taking our little office virtual tour and for taking some time out on this absolutely beautiful spring evening to join us. I'm Dr. Christine Kollmorgen, and this is Dr. Winnie Henderson, and we got the bright idea to start a brand new clinic in the middle of a global pandemic in January. And we've been open for 3 months now and really decided that wellness needs to be the theme of not only our patients' lives and our office life, but also of our own lives. And that's one of the reasons why we designed this beautiful clinic, to not only calm our patients, but to calm us and help us receive more invigoration while caring for our patients. So again, thank you for being here this evening to hear us and see what we're all about.
So as you can see on a video earlier, as you walk through the office, we really try to bring the peacefulness and the beauty of outdoor nature to the inside, to a very calm, peaceful clinic. I think our clinic is unique in focusing on the patient's mental and physical wellness. We have several wellness programs, and then we also have a wellness promise, which after several videos, you will realize what that is all about. And we also have a high-risk breast clinic, which we help high-risk patients develop a plan for close monitoring. We're so lucky today to have Amy Johnson from Oregon Cancer Foundation to moderate this webinar today.
Thank you.
Yeah, I know. As both Dr. Kollmorgen and I are a board member of OCF, we are just honored to have worked with Amy for so many years, and she offered to help us out. We're surgeons, but we're not, technically not very good. So, and we want to make this somewhat, professional looking. So, Amy.
Thank you so much, Doctors Henderson and Kollmorgen. It is my pleasure to be here. And we have quite a few different pieces to share with you today. So we're going to be switching screens quite a bit. So just bear with us while we go through that.
I wanted to introduce the first video here. It really outlines a patient experience and highlights to me how thankful I am for Pacific Integrative Oncology, Michelle Neasley and Stacy Dunn, and Dr. Wang, who decided graciously to co-locate with us part-time. So a lot of our patients end up seeking integrative care as part of their particularly oncologic care, cancer journeys. And we thought, if they're going to seek this care out, why not make it easy for them? So we co-located, and they are in our office where they perform acupuncture and do wellness consultations about 3 days a week. I actually had my first acupuncture session myself, and it was amazing. I would highly recommend it. In any event, that's what this first video is about.
I'm Kelly Warner. A cancer diagnosis can disrupt a person's life in so many ways. Two Springfield surgeons recently opened a clinic that focuses on not only treating a patient's cancer, but their overall wellness.
Renee? Hello, how are you?
When Renee Bisnair was diagnosed with breast cancer, she turned to Oregon Surgical Wellness in Springfield.
It isn't just about getting the cancer out of me, it's about being able to navigate this experience so that I feel confident and empowered and cared for.
Doctors Christine Kollmorgen and Winnie Henderson opened the practice in January, combining their 35 years of surgical experience to create a center focused on overall patient wellness.
Adding areas that they may want to think about to improve their overall health, not just their surgical problem, was extremely important to us.
Recognizing that patients often feel anxious and rushed in a traditional medical setting, they designed their clinic to be a warm, calming environment, from the lobby to the timely one-on-one care patients receive.
We have what we term wellness promise, we have a promise to our community to reach out to these patients within 48 to 72 hours when their referral arrives to our office.
Oregon Surgical Wellness is also co-located with Dr. Michelle Nisley and Dr. Stacy Dunn of Pacific Integrative Oncology, naturopathic physicians who help patients ease side effects from treatment and improve their physical and emotional health through diet, supplements, acupuncture, and botanical medicine.
So many of our patients are seeking complementary care to their cancer diagnosis, and why not make it easy for them? It's not traditional medicine or complementary medicine, that these are integrative treatments best done together.
We've talked a lot about nutritional supplementation through vitamins and minerals. So that was a big piece of going into surgery, was making sure that my immune system was supported and had all of the nutrients that it was going to need to recover and recover well.
It really fits into what we're trying to achieve for our patients, is to prepare them for their treatment and maybe help them after surgeries for their pain and their, feeling well and be a whole person again.
Oregon Surgical Wellness specializes in breast, hernia, robotic, and endocrine surgery, as well as general surgery. Learn more at OregonSurgicalWellness.com. I'm Kelly Warner.
So you're gonna see our next video, and the next video is about how unique we are that we actually have patient navigators. Our clinical staff consists of 3 patient navigators who are committed to assisting our patients through their surgical journey. And this is very important from the patient standpoint because they really want to be taken care of perioperatively. So I think we're very unique that our patient navigators, as you can see on the screen here, we're very lucky to have them.
And all 3 are actually extra trained.
Yes.
They've all been certified, and it was really fun watching the growth. A lot of these folks we've been working with for a while, and after they were able to take the training, it was neat seeing how some of the things they had seen over and over again made even more sense now that they had the background.
Exactly.
I'm Kelly Warner. Managing your way through the healthcare system can be challenging when dealing with a routine health issue, but with a cancer diagnosis, it can be overwhelming. That's where patient navigators come in, helping to guide patients through the process.
You find yourself in a situation you never thought would happen to you, and it keeps changing daily.
Jane Smith has had quite a year. After being diagnosed with breast cancer, she faced additional health challenges. Through it all, registered nurse Kaylee Zuniga was right there to help as Jane's patient navigator.
With a patient navigator that is as skilled and knowledgeable as Kaylee, with intelligent and local resources, it just gives you the confidence that you'll be able to tackle anything that comes your way.
Kaylee is part of a network of navigators at 13 specialty clinics in Eugene and Springfield that work together through the Oregon Cancer Alliance.
Each office chooses somebody to be the point person to help the patient through their office and then get to the next step. It might be a scheduler, it might be a nurse, but it's a key person that knows the history of this patient and what resources that they're going to need as soon as they step foot in that office.
Because we are all linked together by Oregon Cancer Alliance, the patient also feel that the doctors are talking to each other and we're all on the same page, so the care that we provide for them will be unified.
Jane's surgeon, Dr. Winnie Henderson, says navigators are a key piece of a patient's care team, helping them to feel connected and empowered.
When they come to see us and they have all these appointments lined up, they get their diagnosis, they get their treatment plan in place, they get the scheduled surgery dates and the appointments with the oncologist, they have a sense of relief.
You do not feel in control when they tell you you have cancer. And having someone that can either knows the answer or can get you the correct answer for you to make the right decisions for your situation is so crucial.
Learn more about the role of patient navigators and cancer care in our community at OregonCancerAlliance.com. I'm Kelly Warner.
So our practice here, our new practice, really stemmed from our experience with our past patients. And one of the most unique things that we learned from them is that the result, the outcome, the way how they look and feel is very, very important. There are two techniques that is unique to what Dr. Kollmorgen and I do for especially our breast cancer patients. It's called oncoplastic breast surgery, as well as hidden scar breast cancer surgery. These techniques allow us to help these patients deal with their physical as well as psychological burden of cancer treatment. And it's actually very rewarding for us as surgeons to have patients come back to see us post-op 1 year later and showing us that they can't really see their scar. So we are actually very proud to be the only breast cancer surgery hidden scar center in Oregon. And we'll show the next video.
Yeah, it's a pretty innovative approach. Dr. Henderson and I probably, what it was about 10 years ago that we went to the School of Oncoplastic Surgery. We took a course, we worked with models, we worked with clay. We were trained by some of the pioneers in the techniques in the field. And we've just worked really over the last decade to perfect that technique. And then along came Stryker, who actually invented a wonderful retractor that enables us to get into the nooks and crannies of the breast through much smaller incisions that we can hide. And so to become a hidden scar center, we actually had to go through a fairly rigorous training. We had to demonstrate proficiency in the technique. We had to have surgeries watched by an approver, so to speak, to get certified. And since we both practice that technique, we're classified as a center.
So I'm going to briefly go over the surgical approaches to achieve wellness. Oncoplastic breast surgery is actually a very advanced technique of breast surgical oncology, where we are able to combine plastic surgery, surgical oncology, as well as reconstructive surgery. We literally mold the breast tissue together to give patients a nice breast mount. It's truly blending science and art. As you can see, this was pictures of years ago when I get certified, where we actually literally play with clay, so forming art, so to give your surgeons a aesthetic view of the world of the breast. We are certified center for hidden scar breast surgery. With the hidden scar approach, your surgeon will be able to place the incision in a hidden location that's really hard to see, so that the scar is not visible. Now, the end result is that you do not have a visible reminder of your surgery or your experience with cancer in the future after, months and years later. So that's give everyone some happiness and wellness, at least mentally. These are the results of our surgery, and these ladies have different size breasts. And one other thing about, these are all consented pictures, and we as breast surgeons often show breast pictures in our conferences and the presentation. And our goal for doing this is to enhance, enrich, and empower you.
As part of this sort of vocation, I really actually paid a little bit more attention to how patients feel about having their breasts operated on. We're very blessed here in town to be able to work with some very talented plastic surgeons. and work side by side with them and work as a team. And that's always fun to be in the operating room as with another surgeon and do things as a team. It's a lot more collegial. But there's a lot of surgeries that we don't operate with the plastic surgeons, and symmetry really seems to be a very key element to patient satisfaction. People don't like to be asymmetric. And I think the next video will sort of demonstrate the joy that a patient has going through the process.
I was just in East Hampton last weekend and had a bathing suit on, and you know, no one would know that any surgery happened on my body. You can't see anything. Yeah, it is awesome. It sort of hits you like a brick. Cancer. It was detected in a mammogram. Like all that work that I did to take care of my body, and now, no, come on. You can't be serious. I don't have this. This isn't true. I didn't want scars. I've gotten this far without them. I didn't want them. Yeah, I want to look good naked. You know, I mean, of course.
So I never thought about it in the context of how it would change her, right? I just wanted to be healthy. But this is such an intimate piece of your body that I think the anxiety that she had was really, would she be changed as a woman? And I think that was really the thing that I feared most, is that she would change how she felt about herself.
This is a difficult lump to remove without making a scar. And there's a choice of, you know, putting it in a fold of the skin, which you naturally have, and it hides it. We learn about all the chemicals that they're going to pump into our body that are going to make us lose our hair and make us sick. We know them by name, but we don't know that hidden scar breast cancer surgery exists. And we need to know that. We need to ask for it.
The fact that it's not an issue, and it's not a, you know, it's not a tattoo of the event, I think for her, I don't think there's anything that would compare with that.
If I have a scar, it will always remind me that I had it and that I could have it again. So without a scar, I don't have to think about it all the time. I don't have to look at it and remember. But I don't even have a dimple or any kind of a indication that something was taken out of me. I mean, isn't that amazing?
So as you all know and probably come to realize that Chris and I, Dr. Kollmorgen and I, have been trying to perfect the art of breast surgery and breast surgical oncology over the last 10 years. And when you see that you have a program that works, you tend to apply it to other things. So many of you know that Dr. Kollmorgen and I are actually general surgeon, we're board certified general surgeons. So we do other surgeries. We also have other passionate surgeries that we do. We do hernias, and we're trying to apply the same program to our hernia program. We are actually one out of the 3 participating institution for a national hernia registry. We are very passionate about patient outcome. We want patients to have a functional status at the end of surgery. So example is that, you know, for our hernia patients, we actually give them an app that is provided by the ACHQC, which is the hernia registry, to strengthen their muscle and do a prehab before surgery. So we have a program for hernia, as well as endocrine surgery, which is what Dr. Kollmorgen specialized in. And we try to apply our programmatic approach to general surgery as well. And we participate in 4 national registry surgical outcome registry. So we're constantly looking at our outcome to improve our techniques and approach to surgical care. And you can find more information about these programs on our website, OregonSurgicalWellness.com. You know, the year 2021 with a blog in our website. And our website, I think, is really unique, and we have gotten some feedback from many patients as well as colleagues that is very educational, and we're going to continue to make this educational through our blogs and to keep our community informed about surgical issues. And please feel free to reach out to us. We have a button on our website that directly goes to our email. It's actually it's actually monitored by Dr. Kollmorgen and I. And the email, if you want to email us, is info at OregonSurgicalWellness.com. And or you can use the button, and many patients actually reach out to us that way. So I think this will open up our questions and answer session.
It will. I'm actually typing that on the screen.
Very nice.
So for anybody who's interested in it, this is the email address that you can, is that right? OregonSurgicalWellness.com. So we actually do have quite a few questions. Are we ready to get started with those?
Yes.
You bet.
Okay, fantastic. So the first question we had was wondering if you could explain, obviously someone you work with, wanting to know if you could explain the tumor boards that you're involved with.
The tumor board. Well, the tumor board is actually consists of a group of experts in the field. Tumor board address obviously the different types of cancer, and Dr. Kollmorgen and I are very active in the breast as well as the endocrine tumor board, and we bring a patient's case to the tumor board so that we can get opinions from many experts in the field to basically finalize plan for the patient. So instead of seeing one doctor getting their plan, they are literally having the entire panel of specialists, including oncology, radiation and medical oncology, pathology, and the radiology, and we literally go over every single bit of information that the patients have given us. So it's actually a tumor board is a very unique experience for patients, and I think it's very beneficial for the community. And I think it's something that it's crucial and vital to cancer care.
Yeah, I might add, we go to 3 breast cancer tumor boards a month, 2 at Sacred Heart and 1 over at Cedar Clinic. And about 2 years ago now, we started the endocrine tumor board, and it's very well attended and has been a hit. We have that once a month, and it's a great place to present thyroid malignancies, other endocrine problems, adrenal cancers occasionally, and adrenal tumors get presented there as well. And the endocrinologists come and attend that. And it's, I guess the thing that I like about it is it brings the doctors together in a room again. We don't see each other at the hospital anymore. So I think it's very collegial.
And, for gastrointestinal cancer, there's also a GI tumor board that is very, frequently taking place, as well as I think a soft tissue tumor board as well. So I think our community is really great in the way we approach cancer care.
Thank you both so much. So we have a couple other questions. The next question we have is, you mentioned a high-risk breast cancer or breast clinic earlier. Can you explain more about what the high-risk breast clinic is?
You bet. So I'm sure all of you in healthcare out there are experiencing, many patients are, are testing themselves with commercially available testing kits looking for mutations that put them at risk for various cancers. Obviously, the breast cancer genetics are a little bit more well known in culture. Many women are now having these tests and they don't know what to do with the answer. So on the one hand, we'll be providing services to those patients who are wanting to discuss options once they find out they have a genetic mutation that predisposes them to breast cancer, giving them both medical and surgical options and kind of pointing them in the right direction, but also helping women who haven't been tested to screen for genetic mutations. And Winnie can elaborate on kind of an exciting opportunity that came about with another company that helps with this as well.
Yeah, so, basically it's a very comprehensive program where we, see our patients and assess their risk. And then we do breast exam because we're breast surgeon. And we, with the genetic counselor that we are lacking in our community, we are actually setting up a program with a company that actually provide us with testing as well as genetic counseling. And we actually have genetic counselors who work for this company that lives in this town. So we are setting this program up. And, the goal is really to assess patients' risk and then help them develop a preventative plan to reduce the future risk of developing cancer. So I think this is something that, we may be thinking about doing a little bits of this and that, a portion of this and that, but we are formalizing this as a comprehensive program, and we call our program High Risk Breast Clinic.
Thank you. The next question is, what services do naturopathic oncologists provide?
So our naturopaths do acupuncture, of course, Dr. Kollmorgen already mentioned, and they also are, they have special training in natural medicine and nutrition, herbal medicine, supplements, and they actually provide supplemental support for patients who are going through cancer treatment, such as chemotherapy. So that support kind of balances out some of the side effects of chemotherapy. So I know that Dr. Dunn and Dr. Wang, they both do acupuncture, and they have a program where they actually set up the patients to have acupuncture before surgery, and then they carry it through perioperatively and then after surgery, and that helped them reduce their pain.
Nausea and pain.
Yeah, nausea and pain. So I think that is really important. And Dr. Measley is in the process of setting up a lymphedema research program as well as a survivorship program with us. So
she's applied for a Knight grant that's going to investigate education around lymphedema and lymphedema prevention. So we're obviously thrilled about that as well, because as we all know, lymphedema is a collateral damage of some of the things that we do to patients in treating their cancer. So the whole goal really is, you have this disease, we're going to treat the disease, but we don't want to give you another disease while treating the disease. So it's a way to tamp down the collateral damage of treatment.
Thank you. So we have another question. So this one is not about breasts. This individual would like to know more about the hernia program, endocrine, and general surgery that was mentioned earlier in today's webinar.
Well, I can talk about the hernia program. The hernia program is basically, when patients come in to see us for hernia, we evaluate them to see if they're candidates. We focus on smoking cessation, diabetes control. We also focus on weight loss. If patients have too high of a BMI, they may need to lose some weight, and we actually encourage them to and help them, maybe even refer them to a dietitian to help with weight loss, and then refer them to physical therapists for toning up their the abdominal core. There is a app by the HCHQC, which is available for them to download onto their phone, which has videos about exercise. Oftentimes if they need to lose weight or quit smoking before they need surgery, they come in to see us again, and we make sure that they're on track. So it's definitely, we can actually refer them pre-op to physical therapists, and then when they're in the hospital, if they have a big abdominal reconstruction, abdominal wall reconstruction, we collaborate with the physical therapists at the hospital who actually have the same protocol. So it's pretty comprehensive and program. We want the outcome to be that patients would not have a hernia and that they will have a toned abdominal wall so that they would not have recurrence. So that's the goal. And Dr. Kollmorgen can tell you about the endocrine program.
Yeah, I mean, I elaborated a little bit earlier, but I guess the most interesting part of the endocrine program is the outcomes registry is actually a center, not just mine. It's we act as the sort of physician champion for the center. We have employees here that actually upload all of the data that comes from both Sacred Heart as well as day surgery, Riverbend as well as day surgery. And it's called SESQUIP. It's pretty granular data, and it really keeps track of the outcomes of all of our endocrine surgeries. The nice thing too about it is that, you see the trends. It's one kind of random interest is the BMI in our area. We sort of feel that it's excessive, and it actually is compared to the rest of the country. We're in our patients are older and heavier, interestingly, than the rest of the country on patients that we operate on with endocrine surgery, which obviously affects outcome. The other, I think, nice thing is over the last 2 years, we've finally been able to develop some community standards around the treatment, which I think is so helpful. The patient doesn't have to go to one doctor and hear one thing and another doctor and hear another. The follow-up is actually now becoming more standardized, and just really great collaboration amongst the physicians, even though we're all in different groups, which I think is just fantastic.
So I can speak to a little bit about the general surgery program. We actually, evaluate patients to see if they're candidates and make sure that they have good cardiopulmonary function. And, if they need to, we refer them to cardiology or back to their primary care doctor. We communicate with the primary care doctor. One of the things unique about us is that we encourage patients to seek wellness by going to our website and looking under the resource sections of our website. We actually have a section called wellness, and in there they would find music therapy and aromatherapy, as well as meditation. And diet and exercise. So most people was like, what, aromatherapy, music therapy, what is that all about? And I can tell you that these are all evidence-based medicine. These has been tested in big centers. Music therapy, there's a segment of music that was actually played in a research study by the University of Philadelphia,
that show that if this piece of music was played and patients able to listen to it, they actually reduce the amount of pain medications that they require perioperatively in the OR, outside of the OR. And aromatherapy also have evidence that actually help patients lower their anxiety and feel comfortable prior to going surgery. And Dr. Kollmorgen actually have used that in patients and get excellent feedback. And then of course there's meditation, and we have, as surgeons, we see patients who are very anxious. That's the reason why we set up our lobby, as a very peaceful place. We want them to feel peaceful, and when they're anxious, we direct them to do meditation. And this is something that is actually well proven, that has not been incorporated in a lot of surgical practice. And this is something that I believe the West Coast is a little behind the rest of the country, because this has been developed and has been presented in national meetings such as the American Society of Breast Surgeons. So it may sound crazy, but it works. It works. It really works. And when during the pandemic, Dr. Kollmorgen and I, just like everyone else, all stressed out, but we actually sat through these meetings, virtual meetings, and that's all everybody talks about is wellness, how to improve wellness, and all the data came out, and that's how we came about saying, let's start a new business and let's put wellness in our name. And it turns out that wellness is for the patients as well as for the surgeons. We're very happy to be here. Thank you so much, everyone.
Thanks for visiting.
Again, this is recorded, and I will send out a link. And please spread the words. We really want patients to have wellness and great outcome, and to restore their baseline, restore their health. And I think this is a really great approach. And we're very proud of this. And I'm hoping that we're changing the surgical culture in our community a little bit. Two middle-aged surgeons.
Two old ladies.
Thanks, everyone.